In 2012, there was a bacterial outbreak that affected babies in the NICU ward in San Fernando General Hospital. At the time, Dr. Lackram Bodoe was chair of the SWRHA and Dr. Fuad was Minister of Health. We reached out to them to help get context to the current situation at the Port of Spain NICU.
I have found a PAHO document that speaks to infection control. It's a 2020 document, but that speaks to infection control across the health sector. Why am I differentiating and speaking specifically about infection control in the NICU?
Anything below 24, 26 weeks is basically tenuous, and you could possibly have a baby there who will succumb easily to anything. A baby neonate the skin of the baby is not developed to prevent infections.
Health Minister Terence Dialsing noted that the public healthcare system has 92 NICU beds as compared to private healthcare's 2 beds. He highlighted the fact that the public healthcare system accepts every sick baby as well as mothers with difficult pregnancies and explained why private sector might not be as accommodating.
1, the private sector does not want the liability. 2, they don't have the personnel. And 3, they don't have the equipment and facilities. And we accept them willingly and openly and no questions asked.
On the point of liability, Dr. Khan stated that there was a difference between negligence and a breach of protocol. He even gave a possible example of someone being swabbed and not showing any infection even though they were a carrier.
And if you do what is correct and you don't pick up any carrier, which is impossible sometimes to pick up, it just happens. And when you have an infection spreading through a neonatal unit, it spreads like a pandemic. It's nobody's fault.
The former health minister spoke to Minister Dialsing's building on what he found when he came into the post and also called for an end to using this unfortunate situation to gain mileage.
We were able to change it around by developing a proper neonatal intensive care unit. And I must say the minister continued with it when I left. So it's not a matter of pointing fingers. This is something you don't sensationalize, you don't point fingers, yes, the politicians will do what they have to do. But at the end of the day, you have to understand and give the people of Trinidad and Tobago hope.
The rest of the RHA system, even during this very unfortunate incident, operated to deliver health care to our citizens and our children. No other RHA was affected, and the Port of Spain General Hospital continued to perform. All our health centers are open.
Dike Rostant, TTT News.